Okay, so we're going to get started. Can everybody hear me?
Yep.
Okay. So we're going to start with what anti-infective agents are. So you have your bactericidal, which kill the cell and the bacteria directly, your bacteriostatic, which prevent the reproduction of cell growth of the bacteria, resistance, which is when the bacteria or viruses do not respond to a drug that would be supposed to kill them. You can prevent this by dosing or having correct dosing and long enough prescription. And then you have your narrow versus your broad spectrum. So broad spectrum antibiotics or anti-infectives are going to treat a variety of infections, where narrow will treat specific infections. And then you have your culture and sensitivity. So a culture would be done of the infected area, and then it would be grown and tested for sensitivity towards specific medications. So other important key terms are going to be your peak. That is the highest concentration of the drug in the patient's bloodstream. These specimens are to be collected after absorption. So you're going to be 30 minutes to an hour after the administration of the medication. And then your trough is going to be collected before the administration of the drug. It's best practice to have your trough results back before you start administering the next dose. You also see black box warnings. These are warnings from the FDA. They outline the most severe adverse effects of the medication. Okay, so here's just another slide on peak and trough. The slides will be posted, so you can look at this. Okay, we're going to start with chapter 38 and 39. It's going to be your antibiotics. Okay, so we're starting with aminoglycosides. These are going to be known as like your gentamicin, your tobramycin. They work by inhibiting the protein synthesis in susceptible gram-negative bacteria. So they're going to be used for bactericidal effect for gram-negative bacteria, and they are only used in severe infections. With these, you want to be careful. They have a black box warning for ototoxicity and nephrotoxicity. It can also cause confusion, depression, disorientation, numbness, tingling, and weakness. So some side effects you want to watch for are going to be obviously that nephrotoxicity and ototoxicity. You may see a headache, vertigo, rash, a superinfection, and bone marrow suppression with long-term use. As far as nursing considerations, this is one of the medication types that you're going to be assessing that peak and trough level because it has a neurotherapeutic index. Can anyone tell me why you would have safety considerations? Okay, so you would have safety considerations with this medication group due to them possibly being confused and disorientation. And then you also are going to monitor for superinfections. Okay, our next group is carbapenems. So that's going to be doripenem, meropenem. You'll see these used in the hospital settings. So the action is they are bactericidal, and they're also reserved for severe infections. These would be given intramuscularly or IV, and they are broad spectrum. So if someone comes up to your unit and they don't have that culture and sensitivity back yet, they would probably start them on meropenem is what's seen the most. And then they would switch that out to a more specific drug once that culture and sensitivity is back. So with this, you want to watch for the toxic effects would be C. diff. When they're giving strong IV antibiotics, it is also recommended that they give a probiotic to decrease the occurrence of C. diff. C. diff is a contact precaution deal, and it's easily spread. You could also see fluid and electrolyte imbalances, headache, dizziness, and altered mental status, and seizures. So you want to be watching for signs of dehydration. You're going to think about patient safety. You're going to have call lights being an important thing with these patients, bed alarms. You don't want them falling. Okay, so we have cephalosporins. That's going to be like your cefepime, ceftriaxone. They work by interfering with the cell wall that and the building activity of the bacteria during cell division. So some side effects are going to be that they are similar to penicillin. So you could see that nausea, vomiting, diarrhea, rash, bleeding, bone marrow suppression with long-term use. And you have a risk of pseudomembranous colitis. Some contraindications are going to be if you have an allergy, also an allergy to penicillin could be a contraindication with cephalosporins. You're also going to have a caution with renal insufficiency. When it comes to nursing care, you're going to be making sure that they're getting good oral care, that there's fluid replacement in the case of diarrhea. And then you're giving this with food to decrease GI upset. This is also another medication you'll see commonly used in the hospital setting. Okay, so fluoroquinolones, this would be your ciprofloxacin or your levofloxacin. These work by interfering with the DNA replication in gram-negative bacteria. It is broad spectrum. So contraindication is going to be if you have an allergy to them or if you are under the age of 18, pregnancy, and then you would adjust the dose in patients with renal disease, but most likely the pharmacy would do this for you. So side effects for this are nausea, vomiting, diarrhea. A black box warning on this drug is going to be for Achilles tendon rupture. You could also see photosensitivity, headache, dizziness, hypotension, and a prolonged QT interval. So when it comes to considerations with fluoroquinolones, you want to encourage fluid intake, decrease absorption with alkaline foods. So you're not going to be giving antacids or dairy products when using this. Okay, our next group is macrolides. So this is going to be your erythromycin, azithromycin, commonly known as a Z-Pak. So some indications for this are when they need to use a bacteriostatic antibiotic. It's commonly used in STDs or upper respiratory infections. So side effects for these, you have GI side effects, the nausea, vomiting, diarrhea. They tend to use azithromycin because it's better tolerated and has fewer of these side effects. This can also be hepatotoxic, so you're going to watch for jaundice, anorexia, and you could see a prolonged QT interval. So when giving this medication, you want to be aware that this is a highly protein-bound medication, and it can increase the effects of warfarin. So if it's being given with other highly protein-bound medications, you could have an increased level in your blood system. So you're also going to want to take into consideration that this medication can decrease the absorption with the use of antacids. So you would not be giving this medication within an hour of giving an antacid, and you want to take this on an empty stomach. Okay, we're on to penicillins. That's going to be your amoxicillin, ampicillin. These are used for gram-positive bacteria. You're going to watch for rash, superinfection, pruritus. Again, you're going to watch for C. diff, MRSA, and candidiasis, which can all occur with the use of different penicillins. You could see nausea, vomiting, diarrhea, abdominal pain. With long-term use, you can see bone marrow suppression, and you would watch for rash and lethargy. Nursing consideration, again, penicillin groups are another highly protein bound, so you're going to want to watch for that. It can interact with NSAIDs, oral contraceptives, and warfarin. So if someone is taking an oral contraceptive and prescribed penicillin, you need to make them aware that they should be using a backup type of contraceptive during that time, because their contraceptive will not be as effective. Their warfarin will not be as effective. So you're going to monitor for 30 minutes after administration for an allergic reaction. Penicillins are the most common drug allergy. You're going to watch for, or you're going to give with small frequent meals. Make sure they're taking in fluids. This medication will have a decreased effect if it's being given with caffeine. So don't take this medication with a coffee, take it with a water or a fruit juice. Or you're going to avoid fruit juice, sorry, take it with a water. You're going to avoid fruit juice, cola, and citrus with this. Okay, moving on to tetracyclines. This is going to be your tetracycline or your doxycycline. Again, you will see this used a lot in the healthcare setting. Action-wise, it's going to inhibit the protein synthesis in those susceptible bacteria by preventing the cell replication. So you use this to treat Lyme's disease and some types of acnes. It's going to be contraindicated in those who have an allergy to it, liver disease, pregnancy, pediatrics. It will interact with penicillin, oral contraceptives, and digoxin. So you're going to watch for those before giving this. Side effect wise, it can cause tooth discoloration, which is a main reason why it is not given in the pediatric population. It can also slow skeletal development in pregnancy, which is why it would not be given in pregnancy. You can see superinfections with this type of antibiotic. This is another one that could cause pseudomembranous colitis. You could see diarrhea, GI upset, and then photosensitivity. So for nursing considerations on this, you're not going to take this medication with milk or iron preparations or antacids. And then you're going to avoid sunlight. That's a big thing. Or if you have to go out in the sun, you want to protect your skin and eyes. So wear a hat, long sleeve clothing, cover your skin up, and wear sunglasses. And you're going to give this medication with lots of fluids. Okay, so we're on to vancomycin. So this one is another one you'll see a lot. It is used to treat MRSA and other infections. So side effects for this, you really have to watch for ototoxicity, hearing loss, and nephrotoxicity. Vanco is a little unique because you can see red man syndrome from this, and that happens when it's given too quickly. So you're going to prevent that by giving Vanco over a slow amount of time. So contraindication wise, you're going to use caution when giving this medication with other medications that could be oto or nephrotoxic, such as the aminoglycosides. In nursing considerations, you do have to measure peak and trough, and you would infuse this over 60 minutes to prevent red man syndrome. So do not attempt to speed up the infusion rate on a medication like vancomycin. Okay, so we're going to go over protein binding just a little bit here. So drugs form reversible bonds with proteins. Albumin is going to be the most abundant and the important protein that is in the bloodstream, and highly protein-bound drugs will compete for binding sites, allowing more free drug to be released. The more free drug released is going to increase that risk for ototoxicity. So if you have a low albumin level, you're going to need a smaller dose of that drug, because otherwise you would have more free drug being released, and there is an increased risk for toxicity in that case. So can anyone tell me which drugs we would measure peak and trough on? Or which drug is the most important to measure a peak and trough on? Yes, vancomycin. And then along with that, vancomycin and the aminoglycosides, those are going to be your oto and nephrotoxic drugs. So you're going to really watch labs for the kidneys, and you're going to watch for hearing loss. Can anyone tell me which medications are protein bound? Okay, so your protein bound medications are going to be your penicillins and your macrolides. Those are going to be the big ones. When it comes to your bactericidal medications, that's going to be your aminoglycosides, penicillins, cephalosporins, carbapenems, fluoroquinolones, and vancomycin. And then your bacteriostatic are going to be your tetracyclines and your macrolides. Okay, so we're going to move on to the antiviral drugs. We're going to start with some key terms. So viruses, they cannot replicate on their own. They must enter a host cell, and they can be difficult to kill since they are live inside host cells. Drugs that kill viruses also have to kill the host cell. So some common viruses you might have heard of are going to be influenza, flu A and B, herpes, HIV, AIDS, RSV, really big in the pediatric population, COVID-19. So when it comes to transmission, these are droplets. Can anyone tell me what precautions you would take with droplet? So in droplet precaution, you're going to have mask, gown, and gloves. And viruses can also be sexually transmitted. So we're going to start with agents for influenza and respiratory viruses. So that's going to be your zanamivir and rumanidine. So indications would be for influenza that is symptomatic for less than 2 days, and it's given by mouth. Side effects, you might see dizziness, insomnia, nausea, and some orthostatic hypotension. So nursing consideration is that these interact with anticholinergics. So you might want to check with you do want to check with the provider if they're on an anticholinergic and being prescribed any of these antivirals. And when it comes to CNA safety, with them having that orthostatic hypotension, you're going to want to monitor for dizziness. If they're in the hospital, you're going to want to have a bed alarm on them. Make sure they're using the call light when they need to get up. If they're at home, you're going to want to teach them about sitting down, waiting till that dizziness goes away before they get up and start walking, taking it slow, not quickly rising. Okay. Our next one is agents for herpes and cytomegalovirus. So that is going to be acyclovir. It works by inhibiting the viral DNA replication and competing with viral substrates for forming shorter non-effective DNA chains. It would be indicated for use in someone who has herpes and cytomegalovirus. So with this one, you can see side effects such as nausea and vomiting, possibly a headache, rash, hair loss, seizures, and acute renal failure. Nursing considerations would be you want to assess for any loss of consciousness or CNS changes in your level of consciousness, reflexes. You're going to assess skin, making sure they're not developing that rash. You're going to want to assess the renal functions before giving, and you might see orders to monitor renal function. So you could see a CMP. You're going to ensure that this patient is receiving good hydration because it can affect your kidneys. So when giving this drug topically, you have to wear gloves. If you do not wear gloves, you're going to be treated with this drug also. And then you're going to teach about avoidance of driving if they're experiencing any changes in CNS or loss of consciousness there, and then staying away from sex during this time. So for agents for HIV/AIDS, you have your transcriptase inhibitors. So that's your AZT. It works by inhibiting replication of various retroviruses. It can be given orally or IV. Side effects would be bone marrow suppression, especially with long-term use, fever, rash, nausea, diarrhea. You could experience peripheral neuropathy, so you're going to ask them if they're having any numbness or tingling in their hands and feet, anemia and hair loss. So nursing considerations, this medication reacts with alcohol and diadenosine. You're going to want to monitor that CBC, watching for anemia, and watching for bone marrow suppression. Okay, so then you also have reverse transcriptase inhibitors. That's your nevirapine. Can never say that one. Action-wise, it binds directly to the HIV reverse transcriptase. It'll block that RNA and DNA-dependent DNA polymerase activity. So this is given by mouth. Side effects have headache, nausea, vomiting, diarrhea. They can be experiencing rash, chills, fever, and elevated liver function enzymes. So when you're giving medications to treat antivirals, you can see, like in this case, the chills and fever, you can see like cold symptoms. So nursing considerations is that this one is given because it's better tolerated and it has fewer side effects than other ones, but you want to monitor that liver enzymes and liver functions when you're giving this medication. Okay, so agents for HIV/AIDS PrEP, that's going to be your disoproxil, fumarate, tenofovir. So these can only be used in someone who is HIV negative, and they have to be started within that 24-hour time frame of exposure. Side effects would be hepatotoxicity, nephrotoxicity, nausea, vomiting, diarrhea. You could see a change in the immune response. There's an increased risk for osteoporosis and an increase in cholesterol. So with nursing considerations, you would want to confirm the HIV status before giving this, using that HIV blood test. You're not going to use this if someone is Hep B positive or pregnant. You're going to always check for pregnancy and other STIs before giving. You're going to monitor that complete metabolic panel every 3 months. Can anyone tell me what the complete metabolic panel measures? Or why you would want to measure and keep looking at that? Close. So in this case, it can affect your liver and kidneys. So you're gonna watch that complete metabolic panel to check on those liver enzymes and kidney function. Because if they start to see an increase in liver enzymes or BUN, creatinine, they're going to stop the medication. You're watching for that toxicity. Okay, when it comes to protease inhibitors, you have your fosamprenavir. So this works by blocking protease activity within an HIV virus. It's given by mouth. Side effect wise, you could see mood changes, nausea, vomiting, diarrhea, headache, fatigue, rash, Stevens-Johnson syndrome, and hyperglycemia. So contraindications is going to be someone who is pregnant or lactating. And you're going to want to monitor glucose because hyperglycemia is a thing. So especially in patients who are diabetic, you're going to watch that glucose control. Okay, so fusion inhibitors. This is your antivirals. So it prevents the fusion of the virus with the human cell membrane. It's given sub-Q. Side effects are going to be headache, dizziness, myalgia, nausea, vomiting, diarrhea. You could see renal failure, anorexia, and pneumonia. So nursing considerations is that it interacts with rifampin, triazolam, midazolam, pimazide, and oral contraceptives. So again, if they're taking this medication, you would be telling them to use a other form of contraceptive, and then you would question in order for this medication if they're taking any of the following meds. You would also be watching a CMP in this case, since renal failure is an option, and encouraging infection control. Can anyone tell me what would be like your top thing for infection prevention? Yes, hand washing. So you're going to be using hand washing. You're going to teach them to avoid large crowds. That's because pneumonia is one of their side effects. Okay, so the CR5 or your co-receptor antagonist is your Maravirac. So it works by binding to the CCR5 receptor and prevents HIV from entering the cell. This is given by mouth. Side effect wise, you could see dizziness, paresthesias, hepatotoxicity, cough, upper respiratory infection, nausea, vomiting, diarrhea, fever, and rash. So it's going to be contraindicated in children, those who are pregnant and lactating. Again, you're going to be teaching the patient on infection prevention, washing hands, avoiding large crowds, avoiding people who are sick. You're going to be monitoring and assessing before giving liver function enzymes, so watching that CMP. And then you're going to be teaching them to report to their doctor if they think they have a cold. Okay, so we're going to move on to the anti-tubercular drugs. So tuberculosis is caused by mycobacterium, and it is spread by droplets. So you would be using droplet precaution. So our first drug is isoniazid, also known as INH. It works, it's like the drug of choice for a tuberculosis infection metabolized in the liver. It would be contraindicated in someone with an allergy or someone who has hepatic or renal failure. Adverse effects would be CNS changes, GI irritation, peripheral neuritis. Can anyone tell me why you would see peripheral neuritis? So isoniazid affects the absorption of vitamin B6. So that would cause that peripheral neuritis. You could also see hepatotoxicity and seizures. And then we'll cover nursing considerations overall with the two drugs. So rifampin is your other drug for tuberculosis, and the contraindications are going to be, again, someone who has an allergy or renal hepatic failure. With this one, you have a little more side effects. you have headache, it can cause hepatitis. So an expected side effect is this red, orange, brown discoloration of bodily fluids. So it'd be like urine, feces, saliva, sweat, tears, and skin. But you want to make sure that it's like a red, orange discoloration of the skin and not a yellowing jaundice discoloration of the skin. So some special considerations for just this medication is going to be that those taking an oral birth control need to use another contraceptive measure because it is not effective anymore. You're going to teach your patients about the expected reddish orange staining from bodily fluids and secretions. So like it will stain clothing if they're wearing light colored clothing. This also applies to contact lenses. You're going to teach your patient not to wear contact lenses when they are taking this because it will stain the contact lenses. Okay, so nursing considerations for these two drugs. You're going to assess liver function studies. Can anyone tell me what population you would want to pay close attention to when it comes to liver function studies in this medication? Yes, so you want to make sure you're paying close attention to those who are elderly and especially those who drink on the daily. You would want to pay attention to those in liver failure. However, they most likely would not be giving these medications in that case. So you're going to watch for or assess for any contraindications and contact the provider before giving the medication if there's one present. When it comes to patient drug teaching, the drug therapy may last for up to 24 months. Medication compliance is necessary. It's going to be a strict compliance. You want to take that medication same time each day as ordered by the physician. Patients are still infectious during the initial period of the illness. And then specifically with the rifampin, again, you're going to use another form of birth control. You're going to teach them to not drink alcohol during this, and you do not want them taking any over-the-counter medications without consulting their healthcare provider. You're going to give the PO doses with meals to avoid GI upset. And you want to report any adverse effects such as nausea, vomiting, numbness, tingling of extremities, jaundice, fever, and lack of appetite to the healthcare provider. And then you're going to monitor for improvement in TB status. And if you're not seeing an improvement in TB status, you're going to talk to that healthcare provider again, and they will, because it could indicate that the TB is resistant. So we're going to move on to antifungal drugs. We're going to start with some terms. So fungus is a rigid cell wall protective layer that makes the organism resistant to antimicrobials. Mycosis is infection from a fungus. You have systemic drugs such as amphotericin B, fluconazole, ketoconazole, and nystatin. And then you have topical antifungals such as nystatin and clotrimazole. Okay, so we're going to start with fluconazole. So this is used for systemic infections such as yeast infections. It can be prophylactic for candidiasis and bone marrow transplant patients. It can be given either by mouth or IV. Some contraindications are going to be in someone who has renal dysfunction. Side effects with this are nausea, vomiting, diarrhea. You can see elevated liver tests. You could also have abdominal pain, headache, dizziness. It does cause liver renal toxicity. So nursing considerations, you're going to watch for CNS and safety with that dizziness. And then it interacts with many drugs. So you're going to look for interactions before giving and contacting that healthcare provider if they're on any drugs it would interact with. Okay, so we have itraconazole. This works by blocking the activity of sterol in the fungal wall. It's going to be given by mouth and to treat systemic mycosis or systemic fungal infections. So side effect wise, you could see hepatic failure. So you're going to be monitoring that CMP, watching for it. Then you have voriconazole and terbinafine. So they're indicated with invasive aspergillosis or serious infections, and they block the formation of ergosterol and inhibit the CYP2D6 enzyme system, and given by mouth or IV. And then the other one is given by mouth to treat the fungal infection of the toe or fingernail. Last one here is, or not last one, but you have your ketoconazole. So this works by blocking, again, the activity of the sterol on the fungal wall. Indication-wise, you're going to be giving this by mouth to treat same systemic infections that you give amphotericin B in. It would be contraindicated in a patient who has an endocrine or fertility problem. Side effect wise, it blocks testosterone and cortisol, so you'll have hormonal side effects, especially in male. You could see gynecomastia or the development of breasts. You can see erectile dysfunction. In females, you can see irregular menstrual cycle, and in both, you can see hepatotoxicity. So nursing consideration wise, it interacts with many drugs. So you're going to watch for a drug interaction or contact the healthcare provider before giving this if you notice a drug that is contraindicated for use. So for amphotericin B, this is known as ampho being terrible. It has a lot of side effects and is not tolerated very well. So it's indicated for serious to fatal systemic infections, and it's given in the IV form. It is contraindicated in someone who has a kidney disease. So side effects, you have your shake and bake side effects. So that is fever, chills, headache, nausea, hypotension, seizures, dysrhythmias. You can see bone marrow suppression with this, paresthesia, anorexia. They will commonly experience muscle and joint pain. You'll have a decreased potassium, magnesium, blood sugar, and you'll also can see renal and neurotoxicity. So with this one, your nursing considerations are going to be assessing for a decreased urine output to look for renal toxicity. You're going to assess a CMP. You're going to look for hypokalemia. That could be causing muscle weakness and cramps. You're going to do weekly weights. Can anyone tell me why you would do weekly weights or even daily weights in some cases? Heart failure. So you're going to do a weekly or daily weight with this medication to watch for that renal toxicity to see if they're retaining fluids. So when it comes to giving this, you're going to pre-treat with antihistamines, antipyretics, and antiemetics and steroids. You can also pre-treat with heparin, and this would be infused slowly over 2 to 6 hours. Okay, so nystatin, this is given systemically and topically for thrush and then GI or vaginal fungal infections. So side effects would be hepatotoxicity and a rash. Considerations, patients shouldn't chew or swallow the lozenges whole if they're being given in that form. If it's given in like a suspension form or a swish, I guess, fluid form, where they're supposed to just swish it and spit, they really do need to spit. And then in some cases, they'll tell you to rinse the mouth. So like always read the instructions. Okay. For systemic antifungal overview, we have contraindications if someone has an allergy, they're pregnant, lactating, or have renal liver disease. Side effects are going to be headache, dizziness, fevers, shaking, chills, nausea, vomiting, dyspepsia, anorexia. You're monitoring those liver function tests. They can interact with other meds, so you're going to monitor which meds they're on and whether or not they have interactions. You can look for rash, pruritus, or renal dysfunction. So some considerations can be assessing that liver and kidney function, so CMPs, you're going to watch that again. It can take a long time for these drugs to work, so they really need to take the drugs for the entire prescribed time. You're going to watch the IV sites for pruritus. It's not fun if it infiltrates. When it comes to CNS safety, you're going to make sure side rails are up and you're going to be helping those patients with ambulation. You want that bed alarm on, and for them to make sure that they need to be calling because of the dizziness. And let's see, okay, so for topical ones, you're going to have nystatin and the clotrimazole. They work by altering cell permeability of the fungus and prevents the replication causing fungal death. That's going to be indicated in local treatments of mycoses, so like yeast infections of the mouth or vagina. You're going to watch for tinea pedis or athlete's foot, jock itch, scalp ringworm, other ones. Contraindications are going to be allergies to the medications. Side effects would be irritation, burning, rash, swelling. If it's been given as a suppository, you're going to watch for nausea, vomiting, any hepatic dysfunction, or urinary frequency and burning. Some considerations are going to be assessing for breaks in the skin that could cause the systemic absorption of it. You're going to assess for irritation at application sites. That could be an allergic reaction occurring. So avoid scratching, avoiding any occlusive dressings, because you can also see systemic absorption with that. You want to keep that infected area clean and dry. You'd use clean, dry white socks for someone who has athlete's foot. Okay, we're going to move on to anti-inflammatory, anti-gout drugs. So it's going to be starting with salicylates. So it's your aspirin. They inhibit prostaglandin synthesis, platelet aggregation. They're absorbed in the stomach and metabolized in the liver, excreted in the urine. It's used to treat mild to moderate pain and fever. So contraindications would be anyone with bleeding abnormalities and allergy, impaired renal function, someone who's had surgery within the last week, someone pregnancy or breastfeeding. And then you're not going to give this to children who are exhibiting flu-like symptoms or have had a viral illness here, because it could cause Ray's syndrome. Adverse effects, you're going to possibly see GI distress or bleeding. Tinnitus, it's ototoxic. Renal or liver function could be impaired. You may also see an increased action in oral hypoglycemic agents causing low sugars. There's solicitate toxicity. Then you're going to have platelet clotting and bleeding considerations. So for implications, you're going to watch for bleeding, educate your patients on if they're experiencing bleeding to notify their healthcare provider. You're going to watch a CBC and your hemoglobin and hematocrit, and then clotting and platelet labs. And then you're going to watch for Ray's syndrome in kids, and you wouldn't give it to a kid unless it's being prescribed for a specific disease that requires it. So NSAIDs, you have your ibuprofen, naproxen, and ketorolac, which is a short-term use NSAID. They're indicated for fever, arthritis, pain, dysmenorrhea. Contraindicated when someone is bleeding, you're going to hold NSAIDs before surgeries. So GI effects, you're going to look for GI. You could have nausea, bleeding, constipation. You're going to watch kidney functions. Nursing implications, it can decrease the effects of loop diuretics. It can decrease the effects of beta blockers, increase a risk for someone taking lithium, of experiencing lithium toxicity. You're going to assess for bleeding, gastric ulcers. You're not going to use NSAIDs in someone who has gastric bleeding already or who has peptic ulcer disease. And then you're going to monitor renal and liver function. Okay, for the COX-2 inhibitors, that is indicated in the treatment of osteoarthritis. So you're going to watch for abdominal pain, nausea, vomiting, diarrhea, edema, dizziness, headache, insomnia, upper respiratory tract infections, rash, that's Stevens-Johnson syndrome again, exfoliative dermatitis, and toxic epidermal necrolysis. Okay, so implications here. These have a black box warning for cardiovascular events and GI bleeds. So you're going to really watch for that. When taking, you're going to teach them to take it with a meal to reduce GI upset. And they need to immediately report adverse effects such as a sore throat, fever, rash, weight gain, edema of the ankles or fingers, and vision changes to a healthcare provider, signs of Stevens-Johnson syndrome, patient safety. What would be some patient safety concerns with this medication? So because this medication can cause that dizziness, you're going to watch for, like, you don't want your patient to fall. So they're going to be a fall risk. So it's going to be putting a bed alarm on, teaching them to use their call light when they want to get up, side rails up. Okay, so you have acetaminophen or Tylenol. This acts on the thermoregulatory cells in the hypothalamus. It's metabolized in the liver. Some indications are for pain and fever. Adverse effect-wise, you can see hepatotoxicity, renal dysfunction, headache, or hemolytic anemia, skin rash. Nursing implications, you're going to want to assess pain level or assess fever, and then you're going to want to follow up on that and reevaluate. You want to make sure it's effective. You're also going to look at liver function tests before giving. You're going to use caution in patients who have liver disease or renal disease. You're going to teach a patient who would be going home on acetaminophen that they cannot take more than 1,000 during the day. So you're not going to reach that 1,000 milligram mark. Okay, so disease-modifying anti-rheumatic drugs. So that's going to be your hydroxychloroquine, methotrexate. So these are used to alter the immune response and slow disease progression if NSAIDs have failed to work. They're indicated for rheumatoid arthritis or autoimmune diseases. So adverse effects, you're going to have that anorexia, GI disturbance, hair loss, headache, increased risk of infection or neoplasms, and then bone marrow suppression. So some nursing considerations, these patients may not see side effects or effects of the drug for 3 to 6 months. And you're going to put in immunocompromised considerations. So you're going to teach them to avoid large crowds, people who are sick, good hand washing. Okay, so gout medications, they inhibit the leukocytes to the inflamed site. They're used in acute gout attacks. An adverse effect is diarrhea. Contraindicated in someone who has severe renal dysfunction, cardiac dysfunctions, or GI problems. Some nursing implications are you're going to teach the patient to take this food, to take the drug with food, and you would question a prescription for this when someone is taking a statin. For allopurinol, this is a long-term use medication. It works by decreasing the uric acid production, and it is indicated for prevention measures. It will not treat a gout attack. So nursing implication-wise, you're going to watch or monitor uric acid levels. These patients need yearly eye exams. You're going to teach them to avoid the use of alcohol and caffeine, thiazide diuretics. They need to increase their fluid intake, and you're also going to counsel them on like non-pharmacological prevention methods, such as decreasing uric acid intake and diets. So I have a bunch of like questions. We can go over them if you guys want to, or I can post the slides and you guys can go over them on your own time. Does anyone have a preference? Go over some. So our first one is going to be the nurse is teaching a client who is beginning an antiviral therapy for influenza. Which statement by the client indicates the understanding of instructions? I must take the medication exactly as prescribed. Once I start the medication, I will no longer be contagious. I will not get any colds or infections while taking this medication. Or this medication has minimal side effects and I can return to normal activities. Go ahead and put in the chat what you think the correct answer is. Okay, so the correct answer is A. I'll let you guys read the rationale. Okay. Our next question is a newly admitted patient reports a penicillin allergy. The prescriber has ordered a second-generation cephalosporin as part of the therapy. So which nursing action would be appropriate? Calling the prescriber to clarify the order because of the patient's allergy, give the medication and monitor for adverse effects, ask the pharmacy to change the order to a first-generation cephalosporin, or administer the drug with a NSAID drug to reduce adverse effects. What do you guys think the answer is? A. Okay. The answer is going to be A. Why it's up there. You're going to call the prescriber to clarify the order because of the patient's allergies. Patients who are allergic to penicillins have an increased risk of being allergic to other beta-lactam antibiotics, which include cephalosporins. Okay. During patient education regarding own oral macrolides such as erythromycin, the nurse will include which information. If GI upset occurs, the drug will have to be stopped. The drug needs to be taken with an antacid to avoid GI problems. The patient needs to take each dose with a sip of water, or the patient may take the drug with a small snack to reduce GI irritation. It is going to be D. You would teach that patient to take it with a small snack to reduce irritation. Okay. A woman who has been taking an antibiotic for UTI calls the nurse practitioner to complain of severe vaginal itching. She also has noticed a thick white vaginal discharge, and the nurse practitioner suspects that A, this is an expected response to the antibiotic therapy, B, the UTI has become worse instead of better, C, a superinfection has developed, or D, the UTI is resistant to the antibiotic. Yep, it's going to be C. This is all signs that a superinfection has developed. Okay. Which information should the nurse include in the discharge teaching for a client-prescribed doxycycline? A, keeping the remainder of the medication in case of recurrence. B, taking the medication until you have no fever and feel better. C, applying sunscreen or wearing protective clothing when outdoors. Or D, taking the medication with milk to minimize GI upset. Yep, it's going to be C. Doxycycline or tetracycline antibiotic can cause photosensitivity, so you want to be covered up and wearing sunscreen, taking those protective measures for your skin. Okay. Which adverse effects can result if tetracycline is administered to children younger than 8 years of age? A, drug-induced neurotoxicity. B, delayed growth development. C, gastrointestinal and rectal bleeding. Or D, permanent discoloration of the teeth. Yes. So it's going to be that permanent discoloration of the teeth. And you're not going to give it in children younger than 8 because it can cause that discoloration to their adult teeth and tooth enamel that are forming at that time. Okay, when administering a non-steroidal anti-inflammatory drug and a penicillin drug together, the displacement of the penicillin antibiotic from the protein binding sites will result in which effect? A, an increased free drug in the blood. B, a decreased free drug in the blood. C, no change in free drug in the blood. Or D, an absence of free drug in the blood. Yep, it's going to be A. You're going to have that increased free drug in the blood. This is the importance of knowing protein binding and why a drug that has protein bound is important, because the more drug there isn't bound to a protein and is free, you're going to have higher therapeutic effects or toxicity. So, okay, in an effort to prevent superinfections of the GI tract, such as Clostridium difficile or C. diff, the nurse will instruct clients to eat which foods? A, multigrain wheat bread. B, raw fruits and vegetables. C, cultured dairy products such as yogurt. Or D, low-fat meats such as chicken and pork. Think about that good bacteria in your gut. Yep, so you're gonna teach them to increase cultured dairy products such as yogurt. Okay. When planning care for a client receiving a sulfonamide antibiotic, it's important for the nurse to perform which intervention? A, encourage fluid intake of 2,000 to 3,000 milliliters a day. B, avoid direct sun exposure in tanning beds. C, take the medication with dairy products such as milk or yogurt. Or D, advise the client to report any tinnitus to the healthcare provider. Yep, so you're going to encourage them to drink plenty of fluids because this can prevent drug-related crystalluria that can be associated with sulfonamides. Okay, a client prescribed Zithromax expresses concern regarding GI upset that was experienced when previously prescribed an erythromycin antibiotic. What is the nurse's best response? A, take an over-the-counter antiemetic to lessen the nausea. B, stop taking the drug if you experience heartburn and diarrhea. C, I will call the healthcare provider and request a different antibiotic. Or D, this drug is like erythromycin with less gastrointestinal adverse effects. Okay, so this one is going to be D. Azithromycin is the newer macrolide antibiotic, so it has a longer duration of action and less and fewer GI side effects than erythromycin. Okay, for a client receiving an intravenous infusion of gentamicin, the nurse would monitor which laboratory values: A, hematocrit and hemoglobin, B, blood urea, nitrogen, and creatinine, C, prothrombin time and partial thromboplastin time, or D, serum glutamic oxalatic transaminase and alanine transaminase. Okay, so it's going to be B. This is very nephrotoxic, so you're going to monitor those renal function levels. Okay, the nurse will question the use of a fluoroquinolone antibiotic in a client already prescribed which medication? A, furosemide or Lasix, B, omeprazole, C, metoprolol, or D, amiodarone. Okay, so this is going to be D. So dangerous cardiac dysrhythmias are more likely to occur with fluoroquinolones. Okay, so which is a complication of vancomycin IV infusions? Have A, angioedema, B, neurotoxicity, C, cardiomyopathy, and D, Redmond syndrome. Yes, it's going to be D. This occurs when you infuse too rapidly. Okay. The nurse will teach a client prescribed metronidazole, oh my gosh, okay, or Flagyl to avoid ingestion of which drink? A, milk, B, wine, C, coffee, or D, orange juice. Yep. You do not want your patients to be drinking alcohol when taking any type of medication, but especially this, it will cause vomiting. Okay, so a client who's prescribed metronidazole for a gynecologic infection provides the nurse with a list of medications that are routinely taken. Which medication would lead the nurse to question a prescription for Flagyl? Yeah, so it's going to be B. So you're not going to use Flagyl in someone who's taking lithium because it can result in lithium toxicity. So you're going to report that to a healthcare provider before giving. Okay, fluoroquinolones are a class of antibiotics known for several significant complications, which are possible adverse effects of these drugs. This is going to be a select all that apply. So you have ototoxicity, B, nephrotoxicity, C, tendon rupture, D, prolongation of the QT interval, and E, abnormal cartilage development in children. Yeah, so it is going to be CD. So that is going to be the tendon rupture, prolongation of the QT interval, and abnormal cartilage development in children. And this is why they're not used in anyone younger than 18 because of the risk of that. Okay, when providing instructions to clients on the use of an antibiotic, which instruction would the nurse include in the teaching? Select all that apply. A, complete the entire course of therapy. B, increase your fluid intake up to 3,000 milliliters per day. C, wash your hands before and after preparing food. D, notify the provider of any possible reaction that occur. E, save unused medication in a cool, dry place for later use. Yep, so it's going to be A, B, C, and D. So you're going to want to make sure they increase their fluid intake to 3,000 milliliters. And there should be no medication left for them to discard. Okay, so a nurse is ordered to draw blood levels for a person receiving an antibiotic. The nurse is, yes. The nurse is aware that peaks and troughs of serum antibiotic levels are monitored for drugs with A, a narrow therapeutic index, B, large therapeutic index, C, long half-life, or D, short half-life. Yes, it's going to be A, medications with narrow therapeutic index. Okay, when teaching a client about potential adverse effects of an NSAID therapy, the nurse will teach the client to immediately notify a healthcare provider of which effect: non-productive cough, B, black tarry stools, C, diarrhea, D, mild ingestion. So with NSAIDs, you're going to be watching for black tarry stools. This is going to be indicative that they are possibly experiencing a GI bleed. What is the advantage of the COX-2 inhibitor over other NSAIDs? A, they're less likely to cause hepatic toxicity. B, they maintain GI mucosa. C, they have a longer duration of action, or D, they have a more rapid onset of action. Yes, it's going to be that they maintain intact gastric mucosa. Okay, so the nurse knows that Colchicus exerts its therapeutic effect by what action? A, increasing production of lactic acid. B, increases process of phagocytosis. C, decreases mobility of leukocytes. Or D, increases uric acid metabolism. You're close. So yes, it is C. It works by inhibiting the metabolism and migration of leukocytes into the joint. So this is a gout medication. Okay. A nurse teaching a client receiving allopurinol should include which information? A, take the medication with an antacid to minimize GI distress. B, this medication may cause your urine to turn orange. C, include salmon and organ meats in your diet on a weekly basis. Or D, increase your fluid intake to 3 liters per day. So this one is actually going to be D. It is another anti-gout medication. It's what they use for prevention of acute attacks, but you want to increase that intake to 3 liters per day to avoid any of the hazardous, or to help. Where is it? Okay, let's see. Okay. Nurse would question a prescription to administer misoprostol or cytotec to a client with which condition? A, gastroesophageal reflux disease, B, peptic ulcer disease, or C, chronic obstructive pulmonary disease, D, pregnancy. Don't know if you guys have gone over this yet. Yeah, so this is going to be D. Misoprostol is also an abortifacient, and it would be contraindicated in pregnancy. Okay. A nurse should question the prescription to administer aspirin to which client? A 45-year-old patient with a history of a heart attack, a 62-year-old patient with a history of a stroke, a 14-year-old patient with a history of flu-like symptoms, or a 28-year-old patient with a history of a sports injury. Yep, so you're not going to give aspirin to kids experiencing any flu-like symptoms because this could be associated with Ray's syndrome. Before discharge, the nurse is reviewing a client's prescription medication regimen for tuberculosis. The client asks the nurse when or why paroxetine vitamin B6 has been prescribed while continuing to take isoniazid to treat TB. What would be the nurse's best response? A, multi-drug therapy is necessary to prevent the occurrence of resistant bacteria. B, you really should not be on that drug. I will check with your healthcare provider. C, paroxetine is another anti-tubercular drug that will work synergistically with isoniazid. Or D, paroxetine will help prevent numbness and tingling that occurs secondary to the isoniazid. Okay, so this one's going to be D. Paroxetine or vitamin B6 is given with isoniazid to prevent the numbness and tingling, since isoniazid can be neurotoxic and decreases the absorption. Okay. So what information should the nurse provide to a client who is prescribed rifampin? A, oral contraception is preferred method of birth control when using rifampin. B, the patient will only need to take this medication. No, I think this is like your last one. Yep, so it's gonna be C. And then here, yeah. Okay, we are done here. Thank you for joining. Do you guys have any questions? Okay, have a nice night.